bit about your organization.
Okay. We're called Vets to Vets United, meaning Veterinarians to Veterans United Incorporated. And what we do is we rescue, we train, and we partner animals with veterans who are suffering from loneliness, depression, post-traumatic stress disorder, and physical disabilities, and traumatic brain injury. I'm a veterinarian, yes.
And so,
Okay. The type of services we offer are specific to the needs of each veteran. So, for example, if a veteran needs stability, then we would train the dog to be a stability dog, which means that the veteran would be able to put a little bit of weight on the dog if they felt like they were going to fall, or if they felt like they had fallen and they needed help to get up. Then we teach the dog to brace so that that veteran can use the dog in order to help them to get up off of the floor. We also have a dog that we're training for diabetes as a diabetic alert dog. So we are training this dog to be able to detect whether or not a person's blood sugar is too high or too low. And they're actually able to alert the veteran at least probably 30 minutes before the actual meter reading shows that the blood sugar is too high or too low. Other veterans that need emotional support, we're teaching the veterans how to focus on the dog in deep pressure therapy for post-traumatic stress disorder in order to help them to take their mind off of any type of anxiety that they may be feeling when they're in public. We actually train them, so we take samples from people who actually have diabetes and are experiencing blood sugar levels that are too high or too low. And we train them to alert when they actually smell that smell that's emitted from the body, whether it's from sweat or from saliva. They can detect whether or not that glucose level is too high or too low. And we teach them a specific alert for that. And so that's how we teach the dog to alert for diabetes. And the other question was deep pressure. We all know that deep pressure or just actually stimulating a person can cause a release of feel-good hormones, such as oxytocin. So if the veteran, when they're feeling anxiety, has deep pressure applied to them by the dog, for example, if the abdomen is placed right on the lap or the front part is on the lap, and they focus on just cuddling the dog, focusing on the dog and taking their mind off of everything else, there's a release of oxytocin in the brain, not only for the veteran but also for the dog, and that helps that oxytocin has been shown to reduce the level of anxiety. It depends on what type of service the veteran needs the dog for. For example, if you need a stability dog, you want to make sure the dog is at least 55 pounds or larger in order to provide stability for a veteran. Also depends on the size of the veteran. The other thing that's required is that they have good functioning of their joints. So we want to make sure that their hip joints, in particular elbows, shoulder joints, are all examined by a veterinarian to assure that that dog is in a stable condition in order to support extra weight. They just have to really have a good temperament. And again, depending on the service that the veteran needs, we would like for them to, for example, if a veteran cannot bend down and pick up keys or pick up items that have been dropped, we would like for that dog to be able to have retrieval instincts. And if they don't, they certainly can be taught. It just may take a little bit longer in order to teach that dog how to retrieve items. Okay? So the program works like this. The veteran is required to come to training at least 2 out of 3 days per week. So we have training on Monday, Tuesday, and Wednesday from 10 to 12, and we just started a new puppy class from 12 to 1. They have to make a 7-month commitment to come at least 2 of those 3 days per week. And then after that point, they can still stay in the program up to 2 years or more. It just all depends on how much reinforcement the veteran gives the training at home for that puppy. I do this because it's my passion. I love helping people. I love what the U.S. military has done for me, sacrificed their lives for me. My father was a veteran. My sister's a veteran. My father actually died when I was 3 during the Cuban Missile Crisis, and my sister is the first female to graduate from the pilot training program at Tuskegee University, and I've dedicated this program to them. My other passion is animals. I love animals. North Carolina has the highest kill rate in the whole country of all the states for animals in our shelter. So my passion is saving animals, helping veterans. Veterans, right now, the suicide rate has increased from 22 to 27 per day. Every day, 27 veterans commit suicide. Countless testimonies that you can see just if you Google on the internet show that these dogs actually have saved many veterans' lives. And it's the unconditional love that the animals can give to the veteran, or any human being for that matter, that makes a huge difference, in addition to the service that we teach the dogs to provide for mitigating disabilities for the veterans.
Bobby Finch.
Hi, Bobby, how are you?
I'm fine, except I'm a little warm right now.
I guess who's your little friend?
This is Brody, and he's a Bichon Frise. And he got named after his grandmother. He's a purebred, but the people that had him before me mistreated him quite a bit. And when I got him, he was not too friendly. So we've had him on medication for that, and I've had him now for about 2 years, I think. And 3 months before I was diagnosed with bone marrow cancer, I got Brody, and Brody stayed with me in the house for 5 months. And because I couldn't go out of the house or anything because I had no immune system. So he's been a real godsend for me. He started out being just a companion, but now he's learning how to do things to help me.
So tell me what,
Well, he's learned that if I fall, that he knows how to go get help for me.
how does he do that?
Well, I tell him to go get help, and he goes and finds the first person, and then keeps tapping them on the leg until they know to follow him back where I'm laying. And he also I'm hard of hearing, so he also lets me know when the doorbell rings or the telephone goes off, or if someone is in the yard that doesn't belong there. He alerts me to that. And he's learning now how to pick up my car keys, and he's learning how to not be afraid of this thing. And we're going to try to teach him to pick it up, but it's a little heavy for the guy. Say it's bigger than me, but he does a lot of things, and he's very smart. He's already learned how to push the button for the telephone thing, and he likes it because it talks back to him, and he'll do anything for treats. So he's easy to train. I could not have stayed in my house for 5 months without this little doggy right here. He kept me sane in the head. So I just wish I'd have gotten him sooner before somebody else had mistreated him. And it's taken him a while to get used to the fact that everybody's not going to hurt him. So,
And he's accepted.
yes.
Yes, you are.
Say I'm a cutie pie. Everybody thinks I'm just a pet, but that's why I got this little thing says service dog in training, because all the kids want to pet him, and I make the kids not, or anybody not pet him unless I have him sit down first,
Yeah.
so he'll know that it's okay. So when somebody new comes into my house, I have to let him know that it's one of the good guys and they're not going to hurt him, and then he's fine. And he came into my house with 2 cats. And somebody said, how did he react to cats? I said, I don't think he knew what a cat was. It's just a funny looking dog to him. So he's been a real godsend.
My name's Ron Whitfield.
And how are you associated with the organization?
Actually, I was in Costco one day and saw them training the dogs. And because of my work prior, I actually started volunteering to help train dogs. After that, been doing it for 3 days a week and some Saturdays and whatever.
How
Since
did you and Winston come together?
Well, Winston didn't have a handler, so I got to take care of Winston. And we kind of bonded right off.
Or some things you've taught him to do?
Well, Winston can do quite a few things. Winston can open and close a refrigerator door and take something out of a refrigerator. Winston can open a door for you if it has something on it that he can grab a hold of with his mouth. Winston, as you see, can go in, sit here very quietly while we're talking, and this is the position we try to get him in when we're in meetings. So there are a wide variety of things that Winston can do. Winston, no sir, down. There are things such as walking properly beside me, where it's a loose leash walk rather than trying to pull you along. Because of his size, Winston will probably become a diabetic dog, and his good nose. His nose gets him in trouble at times, so that's par for the course, isn't it, Winston? Huh? Yeah, good boy. No, not yet.
Is
That's
this something new for you to learn?
yes,
Yeah.
it is. Either from other trainers, or there are a few books out there that indicate how to do it. I don't think I would recommend that anybody do it on their own, per se. Because first you've got to teach these dogs obedience, and that does take a while. Sit, stand, down, stay, heel, and the basic come, how to enter a door, how to interact, actually not interact with other people and dogs or animals. So you've got that socialization phase in there.
I'm Paul, and this is my dog, Apollo. We've been together for 11 years. He's 13 years old. He's an old fellow. He is my emotional support animal. He came to me when he was 2 years old, and it's the old story of the stepson asked me to take care of the dog for the weekend, and that was 11 years ago. And it has been a wonderful 11 years. Apollo is not a service dog in the traditional sense because he doesn't really help me with any physical problems. But I suffer from clinical major depression. So he's my emotional support animal. And he goes with me pretty much everywhere I go. He's here for me, and if I feel myself, I don't really have episodes, but if I feel myself needing a distraction or to change gears, if someone's stressing me out, I've got him. And I just take him and I go for a walk, or I pet him, or I rub him or something. Apollo and I have a long history together. I had some experience with therapy dogs back when my mom and my dad were towards the end of their lives. And I realized that this dog would make an ideal therapy dog, so we started training and became certified with Delta Society as a therapy team. And we did that for a number of years. And then life happened, and things changed. He is just a very well-mannered dog. He still loves to meet people. That's the reason why it's asked to pet me. I'm friendly because people see a dog like this, and many people cross the street because if he was to bite you, it would hurt. But with him, he is so docile. You're only in trouble if you're a stuffed animal,
Yeah.
and he destroys those, but he loves it. And then through a really, and of course I'm a Navy veteran of 8 years, not retired, and through a bizarre chain of illnesses starting last year in August, I ultimately had a stroke during surgery, and this was on October 13th of last year, 2013. So less than a year ago, I was told I would never be able to work again. And here I'm holding a job, and I'm a volunteer trainer with Vets to Vets because I have a passion for dogs. And after 7 of the last 12 months in a hospital bed, I really have a passion for people that need a break, you know, that just need some caring and tenderness. So we are not currently certified, but he does go with me to the Veterans Hospital in Durham, and he is the biggest hit because I share him readily, and people just love him, and he loves people.
Raises
Oh, sorry. My name is Rosemary Adams. I'm Bobby Finch's caregiver and sister. And we got Sandy when she was 5 weeks old because we wanted to use support for Bobby because she tends to fall a lot. And we looked all around and couldn't find anybody that would train a service dog you already had. So we found Terry. And God sent us in that way. And she's been helping with the training for Bobby and to be able to go off and go to meetings and stuff. And we found out that Sandy doesn't have any hip sockets on one side and partial of another one. But she could still go to get help. She can still fetch stuff, pick up her cane and things. We're working on that. She can still go with her. And she's a very loving dog. So even if they have a disability, they can still serve too. And Terry has been wonderful training. She's very patient. Actually, it's mostly training us. The dogs will do fine, but the trainer needs to be trained, so.
so you go
Yes, I take Sandy. Bobby can't quite handle Sandy yet because she's still very young. And, but she's aging well and she's learning. And, Sandy, come on, babe. Sit. Good. And, she is a lovely animal, wants to learn and wants to give. Okay, that's okay. But she's very skittish because we have a very quiet place and we're training her to be around a lot of noise. She hasn't been beaten or anything, it's just that her surroundings are very quiet. The loudest thing is a fan. So we have to get her used to the other stuff.
Hi, I'm Janet Sowers. I learned about the Vets to Vets through one of my friends that happens to not be here. She told me the story about the first person that she knew that got placed with a dog that was a veteran that hadn't slept through the night until that night that the dog got placed with him. And I said, I've just got to be involved in this program. I have been a naval officer's wife. My ex-husband was prior service in the Marine Corps, and then I met him in college, and when he finished his degree, he went in as an officer in the Navy. And I've experienced a lot of interesting stuff working with veterans and seeing what they go through. I suffer from debilitating depression and PTSD too, so I'm here to help support them. I have major behavioral training. My professor in the psychology department at Averett was trained by someone trained by Skinner. So I have the behavioral skills, but I've never used them on dogs because all of my dogs just met some grisly demise, and so I don't keep dogs now. So I get my dog fixed through this. And I love them. And now Brittany, who stays with Winston that the director Terry is fostering. I usually work with her. She's used as a demo dog, and she will try you. And so that training that we get is really intense when you work with her. You have to really pay attention and work to get her to be comfortable and able to work with you and do what we need to do in training. But she can do things like use the tug command to open and close a door, to go into the refrigerator like Winston. She can help you pull your pants and socks and shirt off. She can get the cane and the crutches for you. So what else? She goes to get help. She's perfect at doing the button, you know, to open the door, like if you were in a wheelchair, and when everybody else is training, she just can't stand it because she says, I know how to do it better. Please let me show them. You know, it's just as funny as it can be. But it's been a lifesaver for me as well, because I've had a rough go for years, and this has been a godsend.
Get you out of yourself, doesn't it?
Gives me a purpose. And what I like about the program and making people come out of the 3 days a week, it's the socialization for the dogs, not just the veterans, giving them the support that they need. It's support for the dogs to give them a chance to make new friends and then to learn things from each other.
I found out about them through a friend of mine. I'd actually been doing a lot of research into getting some kind of a service dog for a while. And several of the organizations that I looked at had multiple year waiting lists, and either that or my children didn't meet the age criteria. So I figured the worst they can say is no. So I actually got up with them. I had just gotten Riley, a day or two before, and it went from there.
Actually, he's the one that called. I just talked to her about what his needs were for a service dog. So
And what were those?
mostly for PTSD and emotional support, and to help.
Well, I mean, there's a lot of different aspects to that as well, along with traumatic brain injury, PTSD, and some mobility problems that have been developing as time has gone on.
So, when she gets older.
I'm really hoping, help with certain mobility things for me. And, when I have nightmares when I go to sleep, maybe she can wake me up or something. That has been discussed before. So, I mean, there's only good things that can come out of it.
She's done really well, actually.
Yeah.
Yeah.
She's learning quickly.
So what does she know to do?
She can sit, lay down.
We can tell her to go to bed and she'll get in her bed or her kennel.
She can stand now,
Yeah, she's learning to stand a little bit on her own.
and she
On her-
knows how to wait before going outside. She has to sit
Yeah.
and wait until the door is completely open before she goes out, until we let her go out. Like,
Yeah.
give her the
She'll
command.
wait until we say let's go, and then she'll follow. Yes. I do get. I'm very easily frustrated. So sometimes, when I'm at home working on certain things with her and she's not picking it up as fast as I think she should, sometimes, that's a situation that I have to walk away from. But I mean, for the most part, I mean, it's been good. I'll hold her and talk to her, and it's been working out so far. for the most part. We're still getting the hierarchy of family members down
Oh, dear.
in terms of the dog's pack mentality.
Yeah.
But I mean, it's coming along just fine.